Good morning, everyone. Dear patient, dear colleague, dear friend. Today I have a very interesting lecture on innovating the future in medicine um, in terms of neuropelveology. That means we'll talk about eBody. eBody means the application of electricity on the body 24/7. So, how to bring electricity on the body? You have three possibilities. You have the application of electricity on the central nerve system is what Elon Musk tried to do is deep brain stimulation because the central nervous system get all information coming from the body will is involved in the integration of all these signals and then will send this information or the answer from the central nerve system to the periphery through two different nerve systems. One is the somatic nerve system, the second is the autonomic nerve system. And the somatic nervous system is responsible for voluntary control of body movement and the conscious processing of sensory information. That means the somatic nerve system, from motoric aspect, is in charge of the red muscle. On the other side, you have the autonomic nervous system or vegetative nerve system, which is divided in parasympathetic and sympathetic. Both systems are antagonists, and both systems regulate involuntary function like cardiac activity, blood pressure, digestion, respiratory activity, bladder function, rectal function. All these functions which not directly involve the brain or the voluntary of the patient. Now we starting with the stimulation of the somatic nerve system. It's exactly what we are doing since more or less 15 years with a Lion procedure. Lion procedure means laparoscopic implantation of neuroprothesis. And for example, in paraplegic, we are doing the Lion procedure on the femoral nerve, on the sciatic nerve, because we want to promote a recovery of the connection of the nerve between the pathway between the central nerve system above the spinal cord injury and below the spinal cord injury. We don't know exactly how it works. Maybe we are providing reconnections, plasticity within the spinal cord, or maybe outside the spinal cord via maybe the vagus nerve. But in any case, we provide a stimulation of somatic nerve. And in the fitness industries, it's exactly what you're doing with EMS, electrical muscle stimulation. But the electricity is applied directly on the muscle through the skin. We can do that medically as well with what we call epimysial electrode. We bring electrode to the muscle below the skin, but with a big issue. When you have a contraction of the muscle, you will have some friction between the epimysial electrode and the muscle, and sometimes a lot of scar tissue will build between the electrode and the muscle and will block the passage of the electricity. That's the reason why in the Lion procedure, we prefer to apply the electricity on the nerve, which provide a very nice contraction of of the muscle and not an on-off but an harmonic contraction. So now we know also that when you provide electricity or stimulation of a group muscle of the body, you will not have just a contraction of this single group of muscle, but you will have all the muscle group of the body are connected together. So if you provide electricity, for example, on the quadriceps on the right, you will provide stimulation or contraction, a reactive contraction of the muscle of the trunk, of the arm, and of the leg, the left leg. And this is exactly what we use in the eBody. eBody means we want to provide 24/7 electricity on the muscle. That means we provide a training and a building on all the muscle of the body passively while allowing you to go about your professional and social activity as normal or even overnight when you're sleeping. And this muscle training will positively influence the osteoporosis by increasing bone density, improving balance, and reducing fracture risk. But more in the high societies, we have a big issue with the fat liver disease. And if you can train the body, even in those people who have no time to go to the gym, then you have a treatment or prophylax against this non-alcoholic fatty liver disease, which is really a very bad disease in, for example, United States with an increasing incidence. So, if you train the muscle in elderly patient, then you have also a kind of treatment of aging. Is a treatment again what we call sarcopenia. Sarcopenia means you're getting older. That means you will lose the red muscle volume in your leg, in your body, and this muscle will be replaced by fat tissue. And you can try to avoid or to reduce this system by increasing protein in your body, but also by providing training of the muscle activity, which is not always so easy in all patients. With the eBody, with a permanent 24/7 stimulation of all the muscle of the body, you have therefore a prophylaxis against sarcopenia. You have an anti-aging method that can be very helpful. So to provide electricity on the somatic nerve system, we have done that already since 15-20 years. But the really break new indication of neuromodulation is once you apply it to the autonomous nerve system, with huge indication for prophylaxis disease and for treatment of disease. So once again, the autonomic nerve system is composed by a sympathetic nerve system, then fight and flight nerve system, and the parasympathetic nervous system, which is good. And both first and both systems are really always in a balance. So the key of autonomic nervous stimulation would be to reach the parasympathetic more than the sympathetic nerve system. And that is exactly what we demonstrated in paraplegic. We applied a continuous antidromic. Antidromic means in direction to the brain, pelvic neuromodulation with low frequency stimulation. And that way, we were able to demonstrate in a paper that came out for 1 month in the Journal of Spinal Cord Medicine that through the stimulation of the pelvic somatic nerve, we have an activation of afferent parasympathetic fibers, and obviously we have an activation of the vagus nerve, which is the main parasympathetic nerve system with big action on different autonomic function. If you have an activation of the parasympathetic nerve system, you will induce a vasodilation. All the blood vessels from your body will get open. So you will have first a treatment against cardiac issue and high pressure. And that's the reason why I mentioned before, when you have a stimulation of the autonomous nerve system, you will treat arterial hypertonia, you will treat cardiac issue by inducing, by using the parasympathetic nerve stimulation and inducing that way a vasodilation of the whole body. And of course, if you open the blood vessel within the bone, you will have a treatment and a prophylaxis against osteoporosis, which is a completely new application of neuromodulation in preventive medicine. You have the brain is exactly the same. If you provide a vagus nerve stimulation, you will have a treatment of depression, and that is an FDA approved therapy for treatment resistant depression. We know about that. That means you provide stimulation on the autonomic nerve system. Somewhere in the body, you will have an activation of the parasympathetic nerve system, and especially the vagus nerve, and then you have a treatment of depression. And of course, if you provide also a central vasodilation in the brain, you improve the cerebral blood flow, which is crucial for delivering oxygen and nutrition to brain tissue. Impair vascular function and reduce perfusion are linked to cognitive decline and the progression of Alzheimer's disease. So, enhancing vasodilation of the brain may help protect brain function against dementia and Parkinson's disease. We know that activation of the vagus nerve improves the lung function, the respiratory function, by modulating autonomic control of the airway. And that is something we found out in paraplegic, in tetraplegic. Here you see a patient, she was using a ventilator due to a very, very high level tetraplegia in cervical area. We performed the Lion procedure, and obviously, through the activation of the vagus nerve, this patient now, today, is able to breathe by herself. And you see on this video, she recovers the function, the voluntary function of the legs as well. We know that stimulation of the vagus nerve activates the cholinergic anti-inflammatory pathway, which reduces the release of pro-inflammatory cytokine. This effect can suppress systemic inflammation and is being explored for treating autoimmune disease such as rheumatoid arthritis and Crohn's disease. And we have evidence for that. We have paper on that. We have scientific evidence on that. We have also evidence that vagus nerve stimulation or parasympathetic nerve stimulation activate the cholinergic anti-inflammatory reflex. So the neuroimmune pathway help control the systemic inflammatory response, potentially improving outcome in severe infection and septic shock. We have scientific evidence for that. And we have first scientific evidence as well that the vagus nerve stimulation helps regulate inflammation, we know, oxidative stress, and sympathetic overactivity. All factors which are involved in tumor progression. Though higher vagal tone has been associated with slower cancer progression and better survival rate in some cancer. So in the future, maybe we'll use the parasympathetic nerve stimulation of the autonomic neuromodulation to treat or to help patients to have a better survival in oncology. So, how to provide such kind of autonomic neuromodulation? But the truth, we don't care. Once you have an approach, when you bring neuromodulation of part of the autonomic nerve system, it will burn. You will have an activation of the whole autonomic nerve system in the body. And for me, the most minimal invasive way to provide an activation of the autonomic nerve system is a genital nerve stimulation, because that is a very, very easy way to bring permanent stimulation to the genital autonomic nerve system, and then to provide patient all the advantage I mentioned already in my lecture. So, neuropelveological entry, we have the Lion procedure, we have the vagus nerve stimulation, but once again, in my opinion, the most easy way to provide a patient autonomic neuromodulation is a genital neuromodulation, or the GNS procedure, which is very, very easy to be performed in local anesthesia in less than 10 minutes. So you see, we are We are, with the neuropelveology, we are moving from the normal surgery where we are cutting, preserving the structure. We start in neuropelveology with nerve sparing technique. Then we move to what can we do with the nerve. We provide neurosurgical procedure within the pelvic cavity by laparoscopy. And now we are entering in a absolutely new way of the neuromodulation. We introduce neuropelveology in the MedTech. And that, in my opinion, is a future in neuropelveology, not just neuromodulation of the somatic nerve system, but the autonomic nerve system. And I think that today we have no idea which will found once we'll start to open this door, which we are already doing. So the MedTech revolution shaping tomorrow medicine will be neuromodulation of the autonomic nerve system. That is the future of the ISON, the International Society of Neuropelveology, not just to have the vision, but to promote education of the coming colleague, the common generation of colleague, and to bring neuromodulation to another level in medicine. For that, we have our education platform of the ISON with certification in level 1, level 2. And I thank you very much for your attention. Have a good day. Keep safe. Bye bye.